Urethral stricture refers to a narrowing or complete obstruction of the urethral lumen due to fibrosis, and is the commonest cause of retention of urine and the most common in young males, usually resulting from previous inadequately treated STIs. The commonest site is the anterior urethra, that is vulva and pineal urethra in males, and it may be complicated by periurethral abscess, superficial extravasation of urine, and uterocutaneous fistulae, retention of urine, and postrenal renal failure. The causes are gonococcal or non-gonococcal urethritis, external trauma, for example, road traffic injuries, falls, straddle or astride injury, and pelvic fractures. Also, could be iatrogenic. That's urethral instrumentation, for example, catheterization, endoscopy, as opposed to operative, for example, prostatectomy, and congenital strictures, which are rare. The symptoms are lower urinary tract symptoms, for example, poor stream, urinary stream, split or split stream, reduced caliber of stream, improved by straining, frequency and dysuria, post void dribbling, and incomplete emptying of the bladder. Urinary overflow, urinary incontinence, and urinary retention is acute or chronic. The signs that are usually elicited are palpable induration of urethra, and there may be none in uncomplicated cases. And periurethral abscesses, extravasation of urine into scrotum and superficial tissue, and uterocutaneous fistulae or watering can scrotum. The bladder may be palpable if there is retention, and the kidney may be palpable in hydronephrosis. Localized induration may be felt along the urethra, and failure of catheterization. This heightens the suspicion of a stricture. Investigations urinalysis, urine culture and sensitivity, blood urea, electrolytes and creatinine, ultrasound scan of kidneys, bladder, post-void residual urine, spongiofibrosis, retrograde ureterogram, antegrade ureterogram, or micturating ureterogram as MCUG, provided a suprapubic catheter is in place. Also, uroflowmeter or uroflowmetry. Also, ureterocystoscopy. The main treatment objectives are to relieve symptoms and prevent complications, to treat underlying cause. Non-pharmacological treatment, try catheterization. A gentle attempt to is made to pass a urethral catheter, which will be held up at the site of stricture in patients who present with retention of urine. A confirmation of site of obstruction is still needed by ureterography or ureteroscopy. If catheterization fails and the patient is in acute retention, suprapubic cystostomy or suprapubic needle puncture and aspiration should be done. And try this procedure if facilities for suprapubic cystostomy are lacking. Aspirate as much urine as possible to decompress the bladder and relieve pain before referral. Definitive treatment is surgical. In most cases, referral to a specialist center will be necessary. Pharmacological treatment, so none except for urinary tract infection. Referral criteria: refer to specialists for further investigations prior to definitive treatment.